Thank you. By agreement with the panel, we'll sit and briefly comment. I would like to again reference the graph that you'll find in the report on page 4, which was put on the overhead, which is the spending graph. And I would like to emphasize that because I think it answers the question, what is the energy force behind this discussion? What is the reason we continue to be preoccupied on Capitol Hill with the conversation of the delivery system of health? It is because this isn't a political disagreement alone. It is an economic and humanitarian imperative. There is no place on the economic leaderboard for a nation that will spend 25% of its gross domestic product in one sector, the healthcare sector. Likewise, we live in a country that very much wants to, or does hold a widely held aspiration that we want people to be cared for when they're ill or when they're injured, and that we see health as a national asset worth protecting. Those are common values, and that is the energy force that drives this discussion, economic and humanitarian imperative. I would suggest that there are 3 things that you can get Republicans and Democrats to agree upon when it comes to that economic imperative. One is that fee-for-service payment is, in fact, at the heart of this problem and the incentives that are baked into it. Second, that coordinated care is substantially better than uncoordinated care. And third, whatever the conclusion is, will require that we make progress in impacting that graph on page 4. We have to bend the cost curve. I think there's also a growing sense of realization that we have really only 3 options. The first is to withhold care, not an American value. The second is to lower quality, not an American aspiration. And therefore, the third and only remaining alternative for us is to change the way we conduct business in order to seek value. This report acknowledges and underscores that important conclusion. It makes a couple of other components that I'll again just mention in passing. One is that we're not very good at this yet. There's a lot of talk about value, and virtually every institution of any note has a slide deck that tells how good they are at it. But when you lift the hood and look underneath it, we're just in the process of learning a very significant number of new competencies that are going to be required to do this hard thing. And therefore, every institution, every provider, every payer, every service provider has new competencies that need to be developed. The second is that this is going to require a sustained effort. This will not happen quickly, and it's likely to require effort by those who pay for care, as well as those who provide care. That the energy that is given by those who are paying is going to be necessary, but that if they move too quickly, it can break the system. And so finding a balance between the pace of payment will be an important responsibility of both. We make the point in the report that both commercial and public payers have a responsibility. And that without that pressure of payment, it will be difficult to get the system to move at the pace that it will be required, but payers have to be careful. And lastly, I'll simply comment on the issue related to the impact of social determinants on health. A second picture in this report that I would call your attention to is on page 13, and it reflects the difference among nations of how we spend money, not just on health care, but on other social programs related to health. I would suggest that an outcome of our most recent and current political debate is likely going to be a substantial amount of pressure placed on government programs related to health care for those who are in financial need, Medicaid. It also is true that Medicaid, as a result of that, will begin to move more toward managed health care programs, managed Medicaid, and that those who begin to take risk, whether they are providers or payers, are going to realize that in order to actually solve that problem, they're going to need to influence more than simply what happens in the clinic or in the hospital. This will be a function of public health, it'll be a function of other state programs, and that we are likely to see a more broadly defined integration, not just in behavioral health, but in things as basic as employment, in transportation, and all other social determinants of health. And we believe, I believe at least, that we'll see that become an outcome of this discussion. So let me just underscore, again, this is not being driven by a political disagreement. It's being driven by shared aspirations and economic and human imperatives. And at the heart of it will be the need to change and shift the way we pay, invest, and evaluate. And the focus will be on value. Sheila?